Sports hernias are also called athletic pubalgia. This occurs in the post-inguinal wall where the transversalis fascia is weak and it causes a bulging to take place. There is actually a zone of weakness that is very close to the pubic symphysis that tends to be weaker in males due to the inguinal ring being there where the spermatic cord goes through. Males have an 8 to 10 times more frequent chance of getting this type of hernia because it is really a natural defect. This anatomically weak area oftentimes only causes pain when it's subjected to forces such as increased intra-abdominal pressures due to coughing or sneezing. The person will complain of predominantly unilateral groin pain. The insidious onset is typical. The pain is localized to conjoined tendon and inguinal canal areas. If you ask the person to take one finger and point to exactly where it hurts, they're going to go to that adductor origin, which is just lateral and superior to the pubic symphysis tubercle. Adduction pain is common. They will complain of progressive pain occurring over a course of several months. It tends to be better with prolonged rest, but it resumes with activity, especially dynamic activity. It is generally unresponsive to conservative measures, and nearly 25% have coexisting pathology, such as an adductor injury or other hip problems. Generally, we're going to look at this when a clinical detectable hernia is not present in that area. There will be soft, painful posterior wall with a Valsalva maneuver and a tender, dilated superficial inguinal ring. What really diagnoses this problem is if there's a lack of the shutter mechanism of the external ring. Treatment is going to be surgical. Post-op massage is huge. You can't over-massage the area. You really need to get the water out of the tissue. The return to play is going to be 4 to 6 weeks. Interestingly, when we're talking about sports hernias, we do have to keep in mind how the adductor injuries and hip problems are linked to this disorder. If you look at elite athletes, they have found that in professional U.S. male soccer players, there's a prevalence of about 54 to 55% of hip and groin abnormalities in these individuals. They have found that just over 37% of the players on the U.S. men's national soccer team have had sports hernia surgery, and 12.5% of them have had bilateral sports hernia surgery. In 66% of these cases, they had a dual diagnosis. It is very challenging because it tends to focus on only one body part, and there's no message that says, hey, it's just sports hernia, not, why don't you take a look at the adductors and the hip itself. You really need to send someone to a hip specialist, a general surgeon who understands sports hernia as well.